Hello, this is Dr. Do again. This video is on alphabetic list of problem on letter G. Today I'm going to talk about the glomerular related disease or diseases. What are the glomerulars? That's the functional unit, one of the part of the function unit in the kidney. I'm going to talk more about it. First of all, let me bring up the information about the emergency situation. Is there any emergency situation associated with the glomerular disease that warrant emergency visit? Yes, because the end stage of kidney disease could be interstitial, could be the nephron caused by the glomerulus, loss of function of nephron, which which is the whole unit, including glomerulus. So this is so what is the signs for the emergency visit? Suddenly developed severe swelling without urine output, especially associated with heart feel palpitation or heartbeat slow or altered mental status. So if that's the case, that is a sign of emergency. I'm sure this could be acute. Usually it's chronic. So for those people with chronic kidney disease, your physician probably already talked to you about the signs that you need to see the emergency. So any disease that related to the glomerulus you can manage at home? Probably not, because the kidney it's a very important organ, and it has to be managed under the medical guidance and medical supervision. So what are the glomerulus? Glomeruli is a multiple or plural form. Glomerulus is individual one. So before I talk about the glomerulus, let's talk about the kidney, fundamental knowledge about kidney. So we have two kidneys in the flank region, and the function parenchyma tissue of the kidney are the nephrons. Nephrons is the glomerulus associated with the tubules and wrapped with the capsules. So this is the structure, basically functional unit of the parenchyma tissue of kidney. So in a summary, that glomerulus is the function unit, part of the function unit for the kidney to filtrate fluid. So I have talked before when I talk about the chronic kidney disease. So this glomerulus actually is a globe of a capillary. So there's the afferent or efferent side. So when the blood flow in, forming the globes of the capillary, and out through the vein system, drain out. So during this blood flow from the afferent arterioles to the efferent venules, so this through the capillary, that's the filtration occurred. What kind of material can be filtered out? Because this filtration is carried out by the filtration membrane. The membrane is formed by the endothelial cells of the capillary, and also the basement membrane and the podocytes, which is some interstitial cells in between of them formed a little slit, so that some of the material can filter out. So this is the glomerular and also the membranous structure around it and along the tubules filled to the capsule, and the capsule connected to the tubules and then going through the urinary system, excreted out. So this is the very brief introduction for this function of glomerulus or glomeruli filtration carried out by the filtration membrane. So what are the common diseases associated with the glomerulus or glomeruli? The first one came in my mind is the glomerular nephritis, which is the inflammation particularly associated with the strep throat infection. So nowadays probably not that common, but past probably 2 decades ago it's quite common. So usually people at about either young or middle age or old age had the sore throat, and a couple of days later developed the the bloody urine. So the urine changed color to red. So this is a typical scenario of the glomerular nephritis. So basically it's because the strep throat, the body generated the antibody attacking the streps at the same time attacking the filtration membrane. So this is actually the type 2 kind of hypersensitivity or type 2 immune reaction to attack the membrane, so then the filtration membrane is broke, so the blood cells can come out. So this is one of the quite common disease related to the glomeruli. And there's some other diseases also could be caused by the immune complex deposit along the membranes, or in the segmental or the focal. So regardless, it's a kind of autoimmune disease, or it's called a kind of immune complex deposit on the membrane and damage the membrane. The protein will come out. So for those kind of this is nephritis. For the nephrotic disease, nephrotic syndrome, usually referring to the protein come out to the urine. But glomerular nephritis is the red blood cells coming out. So this is kind of two streaming of the scenarios. The mechanism is different, and the consequences are different. So usually, if the membrane is damaged, then the protein will come out. And this is about a very superficial introduction of the glomerulus and its associated disease. What are the signs you look for, whether it is glomerulus disease? First of all, like obviously the red urine without taking any medications, because some of the medications can cause the red urine, or without a long run from marathon, because marathon after 5,000 K or 5K marathon can cause this similar presentation, but the mechanism is different. So this is the first time you look, see whether the color of urine changed to red, or you feel swelling, edema. That's the other important sign related to the kidney disease or glomerular disease. So because the protein is lost, the oncotic pressure is decreased, so then has this edema occurred. So this is another sign. Or the urine output is decreased, obviously. Even though you drink a lot of water, but you do not have urine output or less urine output than usual. So this is another sign associated with the kidney or glomerulus disease. So this is the very fundamental. This is referring to the acute situation. In the long run, if you probably those patients or those people already diagnosed by the physician. So the chronic kidney disease, the other important sign is anemia, because kidney is responsible for the erythropoietin, that is a hormone for red blood cells production. So this is the general introduction of the glomerulus and associated diseases, either glomerular nephritis or nephropathy associated with the glomerular and the basement membrane damage, and or the chronic process cause the anemia. So these are the I think I just tried to put everything together, just mainly 3 important signs to look for, or for whether there's a condition related to the kidney, and then you see a physician and to diagnose, and also including those emergency situation, and also there's no way to can be managed at home if it is associated with the kidney, either interstitial or the parenchymal kidney disease. So I'm going to stop here. I hope it helps to remind you if you have any of these kind of signs, and you need to talk to your physician or go to emergency room. Thank you for watching. I will see you next time.